Good afternoon, students. So, in continuation with yesterday's topic, we are going to complete shoulder joint today. In the last lecture, what we have learned the initial parts, the first 3 points of the shoulder joint. We learned classification, we have learned articular surfaces, and we have learned the ligaments. Okay, I hope you have understood yesterday's topic. So instead of making the video longer, I will just start with the next now. So after this 3 main topics, after the first 3 points, what is the next point that we have to understand? We have to understand a very important point, that is relations of the shoulder joint. Okay, now relations meaning the structures which are going to be there in relation to the shoulder joint. So that relations meaning what is anterior, what is posterior, what is superior, what is inferior. Okay, now to understand the relations, we'll try to draw a diagram, which is a simple diagram which you should understand. Okay, so first we'll draw the glenoid cavity here, we'll draw the supraglenoid tubercle, then at one point you will draw the coracoid process, at one point you will draw the acromial process of the scapula. Okay, so this is the coracoid process. Then you will have the acromial process, and this is the glenoid cavity of the scapula. Okay, I will not label this because it will be difficult for me. So you understand, please. So these are the 3 things, so that when we are going to draw the diagram, so you understand this. Okay, so this is glenoid cavity, this is the acromial process, this is the coracoid process. Okay, so now what you have to understand is, first thing is that there is a ligament which is going to be joining the coracoid process and the acromial process. This is called as coracoacromial ligament, or it is also called as coracoacromial arch. Okay, then the next thing that is important that you should understand is this joint is surrounded from all the sides. If you have to draw, it is surrounded from all the sides by the deltoid. Okay, so if you put this coracoid process is going to come anteriorly, acromial process is going to be posteriorly. So this is going to be anterior fibers of deltoid, okay, and these are the posterior fibers of deltoid, and deltoid is going to cover the joint from all the sides. So here you will have the anterior fibers, the posterior fibers, and then superiorly also this will be deltoid. Okay, so this is one thing. Then next thing that you should understand is, from the tip of the coracoid process arises the coracobrachialis and the short head of the biceps. Okay, then anteriorly you have to understand another muscle which is going to be there, that is going to be the you will have the subscapularis. Okay, then posteriorly you will have posterior fibers of deltoid, infraspinatus and teres minor. Okay, and superiorly you have to add another muscle, that is supraspinatus. Okay, and then here you have the infraglenoid tubercle. From here you will have the long head of the triceps, and from the supraglenoid tubercle, a very important, this you should not forget, this is the long head of the biceps. Okay, I will repeat again, just a moment, let me complete the diagram. I will explain this to you. This is how you have to draw the diagram. Okay, so what we have drawn first, we have drawn the glenoid cavity, then we have drawn the supraglenoid tubercle, infraglenoid tubercle, this is covered by the glenoidal labrum. We have drawn the coracoid process, we have drawn the acromial process of the scapula. Then we have drawn first what? We drew first the deltoid, which is there which is covering the joint from all the sides. So it is the deltoid. Then you have this connection between the coracoid process and acromial process, which is called as coracoacromial arch. Then anteriorly from the coracoid process you will have the short head of the biceps and coracobrachialis and the short head of the biceps. This muscle is subscapularis. Then posteriorly you will have infraspinatus and teres minor. Okay, and this is going to be supraspinatus here, and inferiorly you will have long head of the triceps, and from within the joint you will have long head of the biceps that is going to originate. and then here you will have few vessels which are there. Okay, so now I repeat, I hope you have understood how the diagram is drawn. We'll try to label this diagram. If I try to label the diagram, your comments are there. I know the board is very small. I will try and order a big board, but till that time please adjust with this. Okay, so now if you draw this, understand this diagram, what are the relations of the shoulder joint? Anterior relations will be anterior fibers of deltoid, coracobrachialis and short head of biceps, and you will have what? This is subscapularis. So these are anterior relations of shoulder joint. Clear? What are the posterior relations of shoulder joint? Posterior fibers of deltoid, infraspinatus, and this will be teres minor. Okay, infraspinatus and teres minor, and posterior fibers of deltoid. So anterior and posterior relations done. Superiorly will be deltoid, supraspinatus and coracoacromial arch. Okay, and inferiorly we will have long head of triceps. Okay, and within the joint, yes, this is very important. Within the joint you will have a long head of biceps. I hope this is clear. So these are the relations of shoulder joint. Very importantly, it is surrounded from all the sides by muscles. Anterior relations will be anterior fibers of deltoid, coracobrachialis, short to the biceps, and subscapularis. Then posterior relations will be infraspinatus, teres minor, and posterior fibers of deltoid. Superior relations will be the deltoid, the supraspinatus, coracoacromial arch, and there is one more thing which I forgot here. Below the acromial process, there is a bursa which is going to separate it from the shoulder joint. This is also called as subacromial bursa. A bursa means a cushion that is going to be present between the below the acromial process, and when there is going to be movement of the shoulder joint, this bursa is going to prevent the hitting of the head of the humerus against that acromial process. Okay, so superiorly we will have deltoid, supraspinatus, coracoacromial arch, and subacromial bursa. Inferiorly will be long head of the triceps, and within the joint you will have long head of the biceps. Okay, so this is what is called as relations of shoulder joint. Okay, so if you can draw this diagram like this, it will be very easy for you. Make anterior, posterior, likewise this will be superior and inferior. Okay, so these are relations. For those who want to understand how to draw the diagram, you can rewind that video and please check that video and pause the video to understand how to draw the diagram. Okay, so that is about relations. The next point is blood supply and nerve supply. Blood supply of the shoulder joint is by the arteries which are there surrounding the cervical neck of the humerus. You will have anterior circumflex humeral artery and posterior circumflex humeral artery which are going to surround the shoulder joint and supply blood to the shoulder joint. The nerve supply is by the musculocutaneous nerve. You will have the median nerve, and I hope it is the suprascapular nerve also. So that is going to be the nerve supply. Now the last and the most important point before going to the applied anatomy is very important, which you have to remember throughout life, is movements of the shoulder joint and muscles producing movement. Okay, so this is a very important thing which all of us should remember. Now first you should understand that shoulder joint is a multi-axial joint. It will have movements in all the directions. First understand how the movements are done. This is flexion of the shoulder joint. This is extension of the shoulder joint. This is abduction. This is adduction. And then you will have to do two rotatory movements. Medial rotation. This is the medial side. And lateral side. So these are the movements of the shoulder joint. And there is a combination of all the movements, which is a 360-degree movement, which is called as circumduction. Okay. So these are the movements. Now first, if you I will not write this here. So movements and muscle producing movements. First now, when I would suggest all of you to please follow as I am trying to teach you. So this is flexion. Flexion is done by anterior fibers of deltoid, pectoralis major, short head of the biceps, and coracobrachialis. The first two muscles are the most important muscles. The other two muscles are the accessory muscles. Pectoralis major, you can feel it here, and as you are going to flex, you can feel this muscle flexing or contracting. Anterior fibers of the deltoid are here, and then you will have coracobrachialis and short into the biceps, which are going to arise from the tip of the coracoid process, which are going to do flexion. The posterior, the extension of the shoulder joint will be done by posterior fibers of deltoid, infraspinatus, and long head of the triceps. Okay, that would be extension of the shoulder joint. Then flexion, extension. Now it is very important to understand abduction. Now abduction of the shoulder joint is, you have to understand this in degrees. First there is 0 to 15 degrees abduction, then 15 to 90 degrees abduction, and there is overhead abduction of the shoulder joint or above 90 degrees. Now some books say that 0 to 15 degrees abduction is brought about by supraspinatus. Some books say that 0 to 15 and 15 to 90. This whole thing is done by middle fibers of deltoid. So you can keep this in mind. When I have written in my book, I have written 0 to 15 degrees abduction, it is done by supraspinatus. 15 to 90 is done by deltoid, and above 90 is done by trapezius and the trapezius and the serratus anterior, and also by the latissimus dorsi. Trapezius, serratus anterior, and latissimus dorsi. These muscles are going to do overhead abduction of the shoulder joint or above 90 degrees abduction. Okay. When we have talked of the serratus anterior, I have told you how the serratus anterior and all these muscles help in moving the glenoid cavity and taking the the hand above the head or the shoulder above the head. So that is abduction. Adduction. Adduction is going to be done by pectoralis major and pectoralis major. Pectoralis major is an important muscle which is going to do adduction of the shoulder joint. Okay. Then you will have medial rotation. Medial rotation again will be done by pectoralis major, anterior fibers of deltoid, and I think so it is subscapularis. Lateral rotation will be done by posterior fibers of deltoid, and you will have the teres minor and teres major, that is going to help in it. Also the infraspinatus will help in lateral rotation. Okay, please confirm all these actions and the muscles from your textbooks, because I don't want you to make mistakes in writing this, because this is very important. Okay, so that is about action. And circumduction is a combination of all the movements which is brought about by the varied muscles. As and when they are required, they will bring about the 360-degree movements of the shoulder joint. So that is about the movements and muscles producing movements of the shoulder joint. And the last point is applied anatomy. Now, applied anatomy of the shoulder joint, the very important thing, first thing that you should understand is that shoulder joint is an unstable joint, relatively a weak joint, and therefore dislocations of shoulder joint are very common. Okay, and dislocations of the shoulder joint are common inferiorly, firstly because the shoulder joint is least protected inferiorly, and that is why if there is going to be any dislocation occurring in the shoulder joint, it will occur inferiorly. That is the first thing. Second thing which is very important is you have to understand there are two things. Well, you must have heard of frozen shoulder and shoulder tip pain. Frozen shoulder is a disease where there is stiffness of the ligaments and the bursae which are there surrounding the joint, in which the patient is unable to move the shoulder, or whenever he tries to move the shoulder, there is going to be restriction of the movements in the movement, and that causes severe pain, especially during abduction or in any other movement where there is going to be stiffness of those muscles. Okay, so that condition is called frozen shoulder. Another condition which is very important to understand is called as shoulder tip pain, and this is understood that there is actually no pathology here in the shoulder joint. If there are going to be infradiaphragmatic lesions, especially if there is a problem with the liver or the gallbladder, the pain is referred to the right shoulder, because the phrenic nerve which is going to supply the diaphragm travels through this, and this pain which is there in the diaphragm is going to which is there below the diaphragm on the right side or to the left side will be referred either to the right shoulder or to the left shoulder. Okay, so this is, I have purposely made the shoulder joint in 2 videos. I hope you have understood it properly, and I hope you like the video and share the video and kindly subscribe the channel. Thank you.